Hi, my name is Jimi D Katsis, consultant psychotherapist at Arkesi and a member of Counselling Directory. Welcome and thanks for joining me. I'm going to present a very brief overview of acceptance and commitment therapy, ACT. And very basically it focuses on being present, being aware, knowing our values and taking action. The focus and real benefit of ACT therapy is to acknowledge that there is pain in life, and that if we work to reduce the suffering we cause ourselves by fighting against that pain, we learn to accept its presence and how to manage it in order to minimize our distress. And what that does is that it allows us to create emotional and psychological space to focus on what does make us feel better. And so how do we do that? Well, by tuning into the importance of being present, by being aware, by knowing what our values are, and by taking action towards building a meaningful life. By focusing that way, we work towards having less suffering, more satisfaction, and ultimately greater happiness. So ACT is excellent and is proven to work well for a broad range of mental health issues and emotional distress. And we can apply it to many different people experiencing many different things. It can help with workplace stress, social anxiety disorder, generalized anxiety, depression, obsessive compulsive disorder, and even psychosis. It can also be used to help treat medical conditions like chronic pain, substance abuse, and even diabetes. So it can be a really flexible therapeutic treatment. The other thing about ACT is it's built around cognitive behavioural therapy, CBT. You must have heard of that. If not, just Google it, and loads of stuff on Google about CBT. And basically it's a therapeutic model that takes a very mindful approach to thoughts and feelings. And what that means is seeing difficult thoughts and feelings as part of being human and not focusing on actively changing them, but noticing them and allowing them to come and go. ACT also focuses on staying in touch with who we want to be and taking our actions aligned with our values, even when thoughts and feelings make it hard. So it's kind of both understanding and managing what we're feeling, at the same time as taking a proactive approach to creating a pathway towards a more meaningful and fulfilling life. As an ACT therapist, we focus on 6 interrelated processes. Number 1 is diffusion, which is being able to step back from our thoughts and feelings and urges, and acceptance, which is opening up and being willing to experience the full range of thoughts and emotions we're likely to have in our lives. Attention to the present moment, which is about being able to focus on what is here and now around us and within us. And also being able to shift our attention from one thing to another without getting stuck in any one particular kind of area. Self as context, which is about being able to observe our feelings, sensations and our urges, and all of the conceptions we have about ourselves, other people and the world that we live in. Values, which is knowing and being connected with what is important to us. And then finally, committed action, which is about taking active, values-guided action towards our goals. The idea is that if we can develop these skills in our life, we will become more flexible in our thoughts, feelings and behaviours, experience less suffering, and live a more meaningful life connected to what is important to us. So thank you for taking the time to be with me in this really brief introduction of ACT therapy. And if you need any assistance or further help, don't hesitate to get in touch with myself or my colleagues here at Counselling Directory. Bye for now.